Hi, I'm Dr. Ladona Schmidt. I'm one of the family physicians here at Holton Family Medicine.
All right. So, first of all, for an introduction to medication reconciliation, can you explain for our audience what medication reconciliation is and why it's crucial for patient care?
Absolutely, thank you. So each year, family doctors do continuing education, and part of what keeps us board certified so that we can continue to be up to date is to do what's called a performance improvement. This year, instead of going into the hundreds of pre-made performance improvements, I thought, what could I do that would be different that could maybe help the community? Because at Holton Community Hospital, we don't just take care of Holton Family Medicine patients where I am. We take care of the community. That also can include the reservation, can include Onega Clinic, can include patients from Topeka. And what we find is oftentimes patients don't know what medications that they're actually on. And medicine is complicated, not just disease processes, but medication itself is complicated. And so I thought that one of the performance improvement things I could do for the community and for my board certification was to have everybody know exactly what medication that they were on. So part of the project was I was supposed to take 25 patient charts and figure out whether it was accurate or whether it was not. It's pretty hard to do that, not really knowing these patients, especially if they're not from our office, because our office sometimes doesn't get information from other people in the community that don't see us at a Holton Family Medicine. So I decided to start with our office first to see what we could do to get patient medication records accurate. Interestingly enough, over the age of 45, in America, a patient is on an average, this surprised me, of 5 prescription medications. 5 prescription medications for a 45-year-old. I would not have expected that. And as the population ages, polypharmacy, which means multiple medications, are added on. Part of that may be that they see a family doctor, they see a cardiologist, they see a dermatologist, they see a gastroenterologist, and multiple medications are added to their regimen, and maybe their family doctor doesn't know, and certainly maybe the emergency room doctor doesn't know. So my project was called a performance improvement on catch a conflict. So it was not to catch the conflict in general, but to catch a conflict before it causes any harm. So my hope is for the community, every single person in this community who we see in our Holton Hospital or Holton Family Medicine, and then for their specialists or their primary care doctors, that they can be well informed and have a list when they leave our hospital of what they believe or we believe that they are currently on. So it's an attempt to get an accurate idea of what patients are really on, not just their prescriptions, but their over-the-counter medications, their vitamins, their supplements. We want to make sure that we can help when people put that many things in their body to make sure that they really play well together.
Off of that, is it, or how common is it for some of these other medications to be symptom-based counter medications?
Great question. So one thing that I see in my practice is, I'm going to give you an example of just a medication. So a lot of people have joint pain or muscle pain, and so they're on a once a day or twice a day arthritis medicine. Let's just give a simple example of something called meloxicam or naproxen. People don't know that when they take over-the-counter ibuprofen or Aleve, that the combination of that with their current non-steroidal anti-inflammatory could damage their kidneys, could cause an ulcer in more than 60% of patients within 1 month. And so little simple things that we think it's benign, it's not going to cause harm because it's over the counter, can cause tremendous harm. Sometimes patients will get a pain pill from another doctor when they didn't realize that they're taking another medication that is not safe with pain pills. It can actually cause death. And so a lot of people will take Benadryl or Tylenol PM or sleeping aids over the counter that may not be good with their blood pressure medications. And so this is something that I'm hoping can help us have the safest outcomes for all of our patients.
So the basis for the catch a conflict or push is for them to bring in, like you said, we're going to bring in all of the medications. And when you say all of the medications, you mean
I mean all of the medications. And so one of the projects that we put together with this is we got some Holton Hospital bags that we would like anybody who is on more than 3 or 4 pills per day to ask us for a Holton Community Hospital bag. It's a little canvas bag that you can bring all of your medications and your vitamins and your Tylenol and your ibuprofen and your everything that you stick into your body besides the food that you eat. Bring that with you for every visit until we know 100% of the time that the patient goes home with a list of what they're currently on that they can share with every other provider that they see. We really want just safety because falls can occur especially with the elderly. Falls can occur with the youth. No, with anybody.
So to highlight that piece again, we have to be a little bit honest with ourselves. And oftentimes when it comes to medications and conflicts, patients don't want to be completely honest about what they're taking outside of those things that can also cause conflicts.
Absolutely. And that's part of what we want to help. We can't help someone who we don't know what else they're taking. And this is so, I'm hopeful, valuable for patients because we just want to help. We don't want to criticize anybody for something that they may have taken. People are embarrassed that they have to take Benadryl to help them sleep at night. I'm not worried about that. I'm mostly worried about let's make sure that we have the right dosage, the right time, the right day, and if we're taking something else, we might need to make adjustments with current medications. It's a challenge for patients to bring in all of this. It's a challenge for nursing staff to make sure that it's the correct information, but more important, if, let's say that, let me give myself, this is not a true statement, but let's say that I take 2 blood pressure medicines. I don't, but let's say I take 2 blood pressure medications. But let's say that my doctor adjusted my dose recently. The electronic medical record will automatically pull in both doses of that medication when in fact they're not on that. And so when sometimes a patient comes in and says, my doctor knows what I'm on, I don't want to bring my medicines. Your doctor knows what she put you on, but we don't know what else you're on. And this is an opportunity to start fresh and to help patients so that we can truly help have the best quality of life that they can have.
Let's talk about that technology piece because you just mentioned it, and that's a fantastic thing for people to understand. There is a system, a computer system, that all doctors submit a patient's information into. However, it's not foolproof, right?
No,
there are
it's
some
not.
loops and gaps.
There are loops
Explain
and
those
gaps.
to us.
There are loops and gaps in that. That's
I guess first tell us about the system itself, so that for us laymen who don't know that it even exists.
okay. Well, there's lots of different electronic medical records for starters. Some automatically will, if a medication is added, will automatically say that there's a drug-drug interaction. We don't have that system, but we do have a system that is that manually can add it. An example: yesterday, a patient's spouse called, and the neurologist put his wife on a new medication, and so he wanted to double check with me to see if it was safe. So I plugged all of his wife's medication in and found that there was no drug-drug interaction. So it's a really neat system. It does take a bit of time, but it's completely worth it. But when patients really believe that we know what they're on, oftentimes we don't. If they say, oh, I take Tylenol for my back pain once in a while, I didn't know that they were taking 5 Tylenol every 4 hours when it's supposed to be 2 every 6 hours. So that's where we would really like to help and make sure that we're getting the best care for them.
When it comes to other substances interacting with, I was a cop for 14 years.
Okay, yes.
The most common lie we tell everyone, whether it's your friends, your family, but especially your doctors, is how much alcohol you consume, and
100%.
and perhaps even illegal substances that may be especially illegal here in Kansas. But your doctor, of course, that's privilege. We're not here to arrest anybody, right?
That's right.
And
yes.
But how important is this, that we're completely honest about how much we're consuming?
Thank you so much for asking that question. It's so important because all of the states around us do have legal marijuana. And so, but unfortunately, in the current opioid crisis that we are struggling with right now, it's not just opiates, and patients are embarrassed to tell us about other illicit drugs that are out there. And we live close enough to cities, and there's a lot of drugs that are happening in middle school and above. And so even, in the vicinity, within a 20-mile vicinity of us. So we have means to help people with illicit medications. Marijuana is not as safe as we thought it was. Recent studies have shown significant increases in certain types of cancers. Particularly yesterday, it was written that there's a correlation now with smoking weed and melanoma. There are now treatment options, and 2 of the 5 of us physicians currently are working on treatment for opiate disorders. And that's going to be something that will be offered for our patients too very soon. But we'd rather know, if you tell us that you drink 3 drinks per week, we automatically double that because that's how we were taught in medical school. We need to know what you're taking because we can't read your mind and we can't help you, or oftentimes we can harm you. If you come in with joint pain and you're drinking alcohol on a daily basis, then arthritis medicine I give you could exacerbate or cause that ulcer to bleed.
So we've talked a little bit about alcohol conflicting with medications because it's giving false symptoms or false responses. Illegal drugs, especially marijuana, and we know fentanyl is a huge one now, of course, on the black market.
Yes.
Incredibly dangerous, right?
Incredibly dangerous. And what appears to be, from some people on the black market, alprazolam or Xanax, and now what appears to be hydrocodone and oxycodone, now greater than 50%, even in Jackson County, I've been told by the Sheriff Department, has fentanyl. We're now seeing marijuana with fentanyl. And so that's a good question.
So just to be absolutely clear, if somebody, a patient, hypothetical, comes to you and admits to you, being completely transparent with you, that they are taking an illicit drug.
Yes.
You don't do anything with that information.
We do not.
Nobody's calling any cops. Nobody's calling DEA.
We do not. No, we do not report that.
You're solely interested.
It is in the chart, but it is also protected information in the chart just like sexually transmitted infections are protected. So, good question.
I think it's great information for people to understand.
Yes.
There's so much doubt and fear
Yes.
of being honest about some things that
Yes.
you're doing with your private life, right?
Yes.
Especially when you're in a doctor's office.
Yes.
But HIPAA is a very, very regulated regulation.
Very well regulated. So, and we can't help somebody to treat that addiction or that dependence unless we know about it.
Yeah, I think one of the things I've learned since being here, which I thought was so good to know when it comes to your personal security, is that these HIPAA violations that people may hear about affect the hospital. So if a hospital violates a HIPAA,
Absolutely.
it's really bad for them.
It's really bad for them.
Which is why they go above and beyond to make sure it never happens.
Yes. It's interesting, even in a small community like we are in, somebody might have a diagnosis, and it's funny, we're in the same office with them and don't know it. So it's a community that cares for each other, but it's also a community that respects privacy of each other.
So challenges in medication. What are the biggest challenges healthcare providers like yourself face in maintaining accurate, up-to-date medication lists for their patients?
The biggest issue is time restraint. And one of the things that we're asking the community to do is bringing their every single bottle every single time. And that's difficult for them. It is, we are asking our nursing staff to go through every single bottle every single time. That is more work for them. But in the long run, little tiny things like this can make such a difference. And I am begging patients, please don't say, my doctor knows what I'm on, because we want to make sure that we really know what you're on. That is why I chose this as my performance improvement. And I'm so excited to be able to share it with the community, not only at Holton Family Medicine, but hopefully with Onega Clinic, with the reservation, with patients who come from Lawrence and Salina and Topeka, and from Hiawatha. I can name all the little towns around here. We want to make sure everybody's safe.
That's great. And like you're saying, we want to spread this idea, right? This isn't something
Yes.
we're going to keep to ourselves. And that's
No.
another thing that nobody understands about Kansas hospitals. And specifically, Kansas Hospital Association is so good about sharing programs
Yes.
and doctors and ideas like this across the entire state to help everybody, right?
Yes. Kansas Hospital Association really cares a lot about Kansans. And
It's amazing.
And they've worked hard to make it a good state to practice in.
Yeah.
So
I'm really, again, as an outsider, this is my first job in marketing for a hospital. I am so impressed and surprised at the same time at the amount of collaboration and cooperation between hospitals. It's really shocking.
it is. It is.
I think one of the biggest misconceptions is that hospitals are in it for the money, or hospitals make so much money. But
Hospitals struggle, and I think that it's really sad how hospitals struggle. I will tell you that I love this hospital because of its community, taking care of their community. And I drive from Lawrence every day, as you know, but I will keep driving as long as I can help. It's an incredible community.
yeah, that's incredible, really, because you probably drive past 7 other hospitals, right? At least I'm counting. There's 2 in Lawrence.
I drive
Yeah.
by one each
3
morning.
in Topeka, right? Yeah.
Yeah, I do.
That's amazing. That's amazing. All right. How about, we've really covered that one. Time covered. Let's go to advice for caregivers.
There's a lot of caregivers in the community, and a lot of patients who have caregivers are necessary because they can't take care of their own medications. And so there's a lot of different ways that people are comfortable with caring for their family member or friend. Some of the pharmacies actually batch all of their medication on a daily basis. And for people who feel comfortable with it, like what I personally do, even though I only take 2 prescription medications, I take a lot of vitamins. So I put all of my pills into a pill box every day for a week. And so that works well for a lot of people who take care of others.
This kind of ties together too, because just like you said, a lot of the caregivers care for loved ones in particular, right? That's very common in our community, because they can't afford outside nursing or don't want outside nursing in many cases, right? So identifying potential conflicts is so important across this care spectrum that we've got, and a lot of times it's going to start with caregivers or individuals themselves. So how does Catch a Conflict program help identify potential conflicts between medication?
So Catch a Conflict is basically an opportunity to look at every single medication, vitamin, over-the-counter medication that is safe or that is ingested to make sure that it's safe. Another example, if you don't mind. So a patient has some stomach pain. So, it's advertised to go pick up some Prilosec. Well, they didn't know that Protonix was already a medication, or Pepcid or Famotidine was already something that they're on. Long term, some of those over-the-counter medications can deplete magnesium or can cause, and they're having leg cramps. And, so a lot of times if we can just look at every single thing that someone's ingesting, it might help us to help someone's quality of life be better.
Including alcohol and drugs.
Absolutely, including alcohol, drugs, tobacco, illicit and non-illicit, even CBD, which is not illicit, but it's something that it's important for us to know.
That's great one. You caught me on that one. I'm sorry. So even things like CBD, the so-called non-marijuana CBDs, right? Because they've extracted that piece, still have some conflict issues.
Well, it's something that we want to look at to make sure, because of how it's filtered through the body. And so everything has to go through the liver and the kidney. So if someone's got kidney failure or liver failure, we want to make sure that even over-the-counter medications are safe for them.
Legal or illegal. And really it comes down to those symptoms, right? Like you just said. All too often you think the symptom is coming from one thing, but something as simple as depletion of magnesium, like you just pointed out, a leg cramp,
can cause heart irregularities, or can cause terrible fatigue, or can cause leg cramps. And there's just, and the other thing I didn't bring up, Roger, is we need to really ask your doctor or advanced provider, what is this medication I'm taking for? Don't say, I trust you, give me whatever I need. What is this medicine for? And the caregiver needs to know, what is this medication for? Oh, well, is this okay with, so this is for arthritis, but she's taking Aleve 3 times a day, or she's taking ibuprofen. So that's where I want to hopefully impact the whole community.